Ari speaking.
This is Colette Evelyn.
And Kira, she is out for today. So we have our special guest,
Big Booty Bria.
Bria Peacock. She is my bestest friend ever. Known her for over 13 years now. And she is going to become a doctor. She's actually in school for it now. She'll go ahead and finish introducing herself.
Hi everyone, my name is Bria Peacock. I am Ariel's bestest friend. I'm a second year medical student at the Medical College of Georgia at Augusta University. I'm on track to be an OBGYN in 2 years. What else? Oh yes, and I have an organization for teen moms and teen girls called CLA Augustus for Black girls in the CRSA area. We have like roundtable discussions. We teach them about self-esteem, self-worth, healthy relationships, and all the good stuff like that. How not to get pregnant early.
Awesome. That's great. So go ahead and follow her on Instagram. What is your Instagram for that?
Women of CLA. Whoa.
What is
Women of CLA. So Women of SIHLE on Instagram. Perfect. I was putting the website out there. It's womenofcla.org. Follow me.
So yeah, you can follow her. You can follow her Instagram.
I know
and her website for CLA if you want to see what she's doing for the community in Augusta. Also, we can go ahead and introduce the wine of the day. We are doing champagne for the month of December because, you know, by the end of the month, it's going to be January where you're going to be popping champagne bottles for the New Year's. So, also for Christmas, some people do.
Yeah, period.
So, oh, Jesus, we already took the wrapping off, but it is the Andre California Champagne and it's extra dry. On our page, we actually put the brute one because that's normally the one I get, but this is the one we have right now. Same stuff. Smells good. Oh, I got that bubbly. Yeah, I like that. We have to hold that up.
I'm about to say, girl, it's strong.
With a C.
Mm-hmm.
Oh Lord, thank you, Jesus. I need this.
You are a mess.
Extra dry. We don't like anything else to be extra dry.
All right, y'all. Wait, we got cheers. You gotta be drinking, bro. All right, cheers.
Don't feel bad, Bria. I was trying to drink it.
We made mimosas, y'all. With we just used regular Tropicana. Of course, it's good. You never can go wrong with mimosas. Just know that.
That is good.
So you might be hearing us drinking the majority of the time.
Ooh, Lord, that's
Great.
great.
We all smacking.
I know. I know. It's really good. All right. Anyways, best thing to make with that is mimosas. So just get some orange juice, get some cranberry juice, whatever you make your mimosas with. Go ahead and mix them. So anyways, on to the unpopular opinions. It is about women's health on this podcast. That's why we have our brand new expert, or going to be expert.
That's me.
I'm here today. And we're going to go ahead and talk about vaginal odor is always bad. That is our first unpopular opinion. We had some of y'all commenting on this, and it was very interesting. Let's see what the comments say.
Yeah, I need to see this.
Pagan_smiles_ said, health-wise or mentally wise, laugh my ass off. Sometimes an occasional odor can be the cause, offset pH, your period, approaching sexual activity, etc. But it isn't always bad. It's your body's way of letting you know what's up. Mentally wise, bad. No lady wants to have any sort of vaginal odor.
Pagan Smiles, Google is free. You did that. She Googled that. She said, let me copy and paste. I like that.
Copy and paste.
I like that.
Well, yeah, she was the only one on that one, but
point.
she was actually, speaking to us. How do you feel? Do you agree or disagree with that?
I agree with that, okay, because your vagina is the most powerful thing in this world. Whether pussy is power with men, pussy is power on your body. Like, it's a self-cleaning machine. So that means when it's cleaning, sometimes you might have a little odor because you put some bleed, okay? A dirty penis, whatever it is, you put something in there and it's cleaning itself out, and you might get a little bit of odor, but it depends. Timeline is really important. If it's right before your period, blood is not gonna smell like a normal vagina. Blood is gonna smell like blood. So you're gonna smell like blood when you're on your period, right? And what else? So like you're getting over, you put some soap in your vagina. You're not supposed to do that, but you did, and it's cleaning itself out. You might get a little bit of odor with that. But if it's like a week long, that's when you start looking towards a doctor. If it's like you had sex with right down the street, y'all ain't use no condom.
Why you looking like that?
I'm just saying. That's what that
is building.
That's what I'm saying. The timeline and the background is what matters. So it's not always bad though.
Okay.
What else?
She ready for the rest of the
She like, let's rattle them off.
How do you feel? Do you agree or disagree? The unpopular opinion is odor always a bad thing?
Well, piggybacking off of what Bria said.
You gonna go on the future doctor?
I mean that's true though, because I mean it is about the timeline, and like if it's like a long time, like if this been happening for like a
If
little
you walk
bit,
into that room and ain't no issue.
yeah, like that. Like it's like over. It's almost like, cause like everybody know how a period smells,
right?
Like it already
Smell like nickels and fish.
And then if you smell it like that.
If you ain't bad, it smell like
Yeah, it's like if you smell it like that and you ain't on your period. That's not.
What about sweating? Doesn't that?
Ooh,
Yeah.
I mean, if you go into the gym and you got on the cookie cutters, you know what I mean, the coochie cutters.
Yeah, I know what you mean.
And you sweating and all that's right there, just building up. You gonna get some type of odor, just like under boob sweat. You know what I mean? But if you take a shower, that will go away. If you take a shower and you still smelling something, that's a problem.
Yeah.
You just did something wrong. You done messed it up. So, I mean, it's just all background. You got to think about, what did you do before that? What are you doing after that? Are you continue? Does this happen every time you have sex? Does this happen every time you use a certain type of soap? When you go swimming, does that happen? Like, you got to think about what's happening to bring on the odor, and that's telling you if it's really bad or not.
Right.
Do you know if chlorine water throws your pH off?
Everything throw your pH off.
Like, literally.
Everything, like literally. I would say like don't go swimming, because I love to swim. Okay. And that doesn't happen to me. It doesn't mess up my pH. But there are some people where if you out there and you doing all these, I know you can't see my legs, but you doing all this in the water and you letting it all get up there, it could possibly mess up your pH. So it's like, you don't, just like eating stuff, like when they say food causes cancer, you're not gonna not eat it. You just need to think about what's gonna irritate your vagina and what's not gonna irritate your vagina. So everybody's vajayjay is different.
Yes, I agree with what all y'all are saying. So vaginal odor is always bad. We had a mix of it. Some people say yes and some people say no. That's because a lot of people just don't like smelling themselves. And I don't blame y'all, because I do not like smelling myself.
But another thing is, hold on. Because you know when your man come over, and you don't want to be that girl that they say smell like tilapia.
Not tilapia.
Smell like tilapia. If I smell like tilapia ever, oh my God, I would cry.
But that's really what that's coming from. Y'all know it's coming from men. Like, she smell like,
it's crazy because
like salmon, but you still hit it though. So what?
Right. That's what I was
gonna say about you.
Like, my sister, she told me about some of her friends and some of her frenemies, I guess you can call them. And one of the girls had that smell.
Oh yeah, I know you're talking.
Yeah, and they couldn't understand why she couldn't smell herself. Like, does it eventually you just stop smelling yourself? Because I feel like I smell myself all the time, and I be wanting to ask people like, do I stink? And nobody says anything, so I'm like, oh my God, I don't know, because you smell yourself before everybody else.
Smell you. But she don't smell herself. But the thing about that is, people don't really, especially when you growing up, you think your vagina is supposed to smell like strawberries, peaches, creams. Pussy smell like pussy.
Whatever that is.
That's what I'm saying. It smells like vagina. So like, but men and sometimes younger women don't understand that your vagina is not supposed to smell like fruit.
Right.
It's supposed to smell like a vagina. Now, if you think that's a bad odor, then I can't really help you with that because that's how your vagina is supposed to smell.
Right.
So, I mean, it comes with maturity, man. Y'all just need, if you don't know what your vagina is supposed to smell like, you don't need to have sex. You need to be sitting at home reading books, drawing, crayons, all that, coloring books, something.
Yeah, but then another thing is guys still will have sex with girls that do that because once again, back to my sister's friend, she was still sleeping with so many people and they will still hit it, but be saying that they hitting it with their nose away from her. Like, ew, if it stinks that bad, why are you? Right, I know you that horny to where you couldn't not hit it because she smells like something's wrong. Because what if that was like an STD or something? Y'all just still having sex with her just because you want to have sex. Like, that's dangerous. Like,
and with STDs, like, they do, sometimes you might not have symptoms, sometimes you will. But you get that odor, you still need to be on guard. Like, you still need to be like, let me figure out this timeline. What did I do? Was it when I had sex? All this stuff. But douching or putting all that stuff in your vagina, it's not going to bring the it's not going to take the STD away.
Right.
You see what I'm saying?
Right.
So, you smell that odor, you got this itching, and you're like, let me go get some Summer's Eve. Okay, you still going to have gonorrhea next week, though.
Right.
You feel me?
Right.
It's going to be strawberry gonorrhea, though.
Strawberry gonorrhea. You want strawberry gonorrhea?
That was a flavor, you know.
You just adding a good flavor to it. At least he won't smell it. He just smells the strawberry. He don't smell the gonorrhea.
And that's dangerous because it's funny, but a lot of people do that. A lot of people do that. They like get the Summer's Eve. They don't know they got an STD because they don't like getting tested. And then you get married and you don't know why you can't have babies. Because you don't have an STD for 6 or 7 years and you've been covering up with Summer's Eve. Right. So, like, get tested, man.
Get tested.
You got an odor. You done had an odor for a couple weeks. You know you had sex with Ray Ray down the street. Like, that's not going to kill you. If you get tested, you going to know. That's the good part about it. And with a lot of stuff, you can get a pill. It'll go away in a week. Some stuff won't.
like Usher herpes.
Right. But
Like,
a lot of stuff will. A lot of stuff you can treat.
Yeah.
So like you don't want to keep passing that around. You don't want to be tilapia. You don't want to be
You don't
strawberry
wanna be
gonorrhea. You don't want
tilapia. Don't be tilapia or strawberry gonorrhea, y'all. Okay. So that goes on to the next the next unpopular opinion, which is wearing tight underwear causes yeast infections.
You remember when I said that at middle school? Oh, I got in a fight. Well, never mind.
What happened?
I was a different person in another life. Well, one time I got in a verbal.
This is not how she is now.
The Lord has told me. The Lord has told me.
The emoji.
Right,
baby.
And y'all know growing up, you used to jank people or Joan or whatever you want to call it. You had to learn how to Joan back or you was going to get bullied. And one girl, I had it just in my back pocket. I was like, she going to say something to me today. I'm going to be like, that's why you got to use the infection. You're wearing a 3 when you really need a 7.
You are stupid.
No, but seriously though, tight underwear can cause a lot of stuff. Tight pants can cause a lot of stuff down there. I mean, it needs to breathe. Like I said, it's a self-cleaning machine. When you got it all bottled up like this, I mean, stuff is going to go awry. It's going to start messing up. So I wouldn't say causes yeast infections, but it does have a hand in it if you continuously wear something that your vagina can't breathe at all.
So let's do the cotton versus other type of underwear debate. Is that true or is that a myth?
I'm not here to disclaim myths. Scott. I say cotton underwear is safer for your vagina. You got like silk, and the silk is not really having like the porous part that the cotton
can
has,
breathe.
right? So you can't really breathe with silk lace, even though ain't nothing wrong with Vicky's secret.
What was that? You retarded blink eye.
I still can't wink, guys. I still try. But yeah, I mean, ain't nothing wrong with Victoria's Secret every now and then. Ain't nothing wrong with the thong every now and then and all that stuff. But cotton, say you are having a problem, you need to try to change out your underwear. Maybe wear more cotton. Do the granny panties for a little bit. Hey man, look. I still look good. I still got booty. So I think that is kind of true though. The tight underwear, tight pants.
How do you feel?
Yeah, no, that's true. I mean, unfortunately, you can't wear lace every day, you know. I mean, cotton is just, if they made like real cute,
yeah,
that's really what it is.
They
We want to be
do,
cute
though.
all the time.
They
Cute like what?
Because
Granny panties, you know you say that for your period. You just, that's what I'm wearing.
You know,
I have some cute cotton board shorts.
Yeah, that's what it is.
Okay.
The board shorts.
Oh, I like board shorts.
What's the one? The cheeky?
The cheeky.
The cheekies are
Yeah,
cute.
those are cute. So,
Well, how about underwear versus no underwear?
ooh, Nicki Minaj. That's who I just thought about when you said that.
Break it down, girl.
Cause I mean, you wear no underwear all the time with jeans. That's nothing but irritation. You see what I'm saying? But if you wearing no underwear with a dress and you sit down on the seat, you know what I mean? There's no barrier. So I'm not really a fan of the no underwear thing. I mean, if I'm going out, I got a club dress on.
Yeah, that's different. You want the pants
That's a
line
little
showing.
different. I don't know it.
Every
As
day,
far as
every day, not
every
going
day.
out, every day.
Like, if you going to school, put some drawers on. If you going to work, you need to have some drawers on. Why you want that, just out there? And then you're going to have a whip. I just started thinking of that cartoon where she was over the sewer and it was just blowing up like that. Ooh, you want all that air in there? That's nasty, all those particles. No, I'm not with that. I'm not on the no underwear squad, but
You a no underwear squad?
I'm not a no underwear squad, but I mean, for certain things, that is true. Like, if you don't want to have a panty line,
like if you going out,
Yeah.
that's different.
But just like you said, that just even thinking about it, like you sitting down,
Right. You
In a
sitting
club.
on dirty, farted
People-
on, boo-boo.
And then
pee.
people they love staying on the seat.
True.
And they
Dirt.
don't walk in that dirty bathroom with them shoes. I think about all that stuff. I want nothing to touch my vagina that's gonna mess it up. It's beautiful.
Do you have a witness? Okay, cool. Yeah, I mean, I'm not really with the no underwear thing either. I just don't feel right not wearing underwear.
It does feel bare.
Yeah. Unless, like I said, unless you're going out to the club, but an everyday thing, nah, I can't do it. I feel like like you said, you be thinking about it when I'm sitting down and I don't have underwear on. You're sitting on a chair. You're like, who was sitting on here? Who was standing on here? Like, was that person dirty? Was the shoes dirty? Was there a dog sitting on here? You know, like just things like that. Bugs being on there.
I mean, but if you want to air it out and you want to chill, you can like not wear underwear to bed. That's a whole 8 hours where you not having underwear on. Like if you just wanted to chill, whatever you need to do. But as far as like going out in public and letting all that dirty air in, I ain't with it.
Okay.
You gonna be dry like this champagne. Extra dry. What is that?
Extra dry.
You don't want that. Mm-mm.
All right, moving away from yeast infections and vaginas, we're still stuck on vaginas, but we're gonna go towards birthing. So the next unpopular opinion was that Black women can't trust doctors when giving birth. How do you feel about that, knowing that you're about to be a doctor in a couple years? Do you want them to trust you? Well, you're a black doctor,
It's
so I
different for
guess,
me.
yeah, they will probably be looking for you.
Yeah,
versus-
that's usually how it goes. I thought I had an answer to this when you asked me before. Well, this is so personal to me because this is kind of why I became a doctor, like why I wanted to go to medical school. You already know my sister's a teen mom. She was like OD judged in the delivery room, 16 and pregnant. So like, you know, the typical black girl stereotype, and I witnessed that as a child, so that made me like go into medical school and do what I had to do to kind of change the face of medicine. But black women, it's very true, the maternal mortality rate for black women is off the charts. It truly is. Like, white women who smoke have a better chance of surviving than healthy black women.
That's crazy.
So it's really real out here. They're trying to, you know, do what they can, but a part is like the doctors think that we can handle more pain than we can. So when we complain of pain, it's not like you see the Serena Williams thing that happened, Gabby Union. It's not like they don't want to believe us. It's just that they think that we're over exaggerating. So what happened with Serena Williams, she had a clot in her leg that ended up going on to her lungs, and that's how people die a lot of the times. Like it's called a DVT to a PE, and she almost died from that after childbirth. So when she started complaining of her leg and her leg was swelling, we know what's wrong with our bodies. She went to her doctors and they're like, I think you're over exaggerating, but just sit on it for a minute. Sit on it for a minute without actually hearing her out. And that's where black women, black men, even minority women come into play, where it's like, okay, I know, I see her, and I know that that's my mom, that's my cousin, that's my auntie, so I'm going to be more able to listen to you and understand what you're saying than somebody who's never really conversed with a black person before. Because it's just this, I mean, that's historical though. It's always been felt that we can handle more pain than we can have. During those slave days, during those, you know, just our background with Africa and all these things. We can, you know, I can go for days. I can go for days about my history now. But that's how it has been in this country, that they always feel like we are strong when we are, but when we have pain, we really have pain.
When we have pain, we speak out.
We
about
are not, and some people do. That's another thing. Our history with doctors, Tuskegee experiments, and things like that. We're less likely to go to a doctor until it's too late. Just because a lot of black people, we know our uncles, cousins, aunties are afraid to go to the doctor.
And it's crazy because even the Tuskegee experiment wasn't that long ago. When you think about it, it was only like 50.
Can I get away with it?
50 years ago. And then when you think about it, they're still doing a lot of testing on people in general, but they're doing it in the prison system.
You want my shit out?
Whole deal.
But it's crazy how it comes with the history, why they think we can handle more pain and why we don't speak out until the pain gets unbearable. Which it could be too late for some people. Just like,
a lot of the time,
did you hear about the story in Florida when the lady her mom had called the ambulance to come pick her up because she just had a baby and she was experiencing pain, and when the ambulance got there, they asked her, "Are you sure you in pain?" and didn't want to take her because they thought she was just playing around. And they were like, "Oh, you can't afford to come into this ambulance," even though they're sitting there saying, "Hey, we have insurance, we have this." We shouldn't have to prove to y'all that we have and are capable of going to a hospital. At the end of the day, if you're coming to me as somebody who's supposed to be saving lives, you should just be focused on saving my life and not worried about, they're not gonna pay me tomorrow. Why are you getting in a field where you're more concerned about the money than you are about helping somebody?
And I can say, not every non-black person is like that. I'm gonna go ahead and be the devil's advocate.
Of course.
Because, I mean, they do try to filter who's becoming This is a lot of older people that you're dealing with that are, oh Lord, where does being aired at? No, but the thing about it is, it's like they're trying to change that, not only with the people that are practicing, but the people who are in the position I'm in, who's training.
Mm-hmm.
They do like cultural competence. They're telling them about, okay, this is why a lot of black people don't go to doctors. This is the food desert. So they're training everybody, not only on what your body looks like, but how are you going to talk to a patient that doesn't look like you? Mm-hmm. So like you can kind of I would feel comfortable with anybody. I'm going to give everybody a fair shot. You know what I mean? I don't want people being like, I ain't going to nobody but a black doctor. Because, you know, that white doctor might save your life.
Right.
So it's not everybody, but it is a problem, especially here in Georgia. You know, I think we're number 48 for maternal mortality rate.
Whew.
So that's big. And it comes with, like, the OBGYN shortage and all that stuff. But, like, I don't want anybody to listen to this and be like, I can't go to nothing but a black doctor, because that is not true. You know,
right.
There are brilliant white doctors, brilliant Asian doctors, brilliant yellow, black, brown, whatever. If they can help me.
Right.
Okay? But listen to me.
Right.
Know me.
Right.
Know everything behind
Right.
me as a patient. Don't just see me as a number. See me as a person. That's the kind of doctor you want.
Right. And what ended up happening to that lady in Florida, she died.
Yeah.
Because her mom ended up having to take her to the doctors, and she ended up dying. Had a brand new baby. The baby was probably like a few days old. So it's like, not even just the doctors, but the paramedics don't care. So it's like, who could we go to for help if no one's willing to help us? And I think that's what goes back to what you're saying. Like, if you could help me. But when you're dealing with stuff like that, it's hard to sit there and be like, oh, I'm going to go to a person that doesn't look like me, because it's like we're hearing these stories constantly about, oh, the mortality rate is so high. They're not listening to us. They're not listening to our pains. They're not listening to any of that. So then you're sitting here and you're like, shit, I'm scared, because then what if I'm the next number? Because that's what ends up happening.
The thing about, but you gotta think about, it's so many things that go into it, man. It's people don't want to have prenatal care. Mm-hmm. If you ain't got insurance, well, if you are pregnant, this is the thing. If you are pregnant, if you don't have insurance, you are covered by the state. That does not mean don't go to a doctor. It doesn't matter if you ain't got no insurance right now. The minute you get pregnant, you cover under Medicaid. Mm-hmm. You need to be seeing a doctor every month, every week, following up with somebody. Because at the end of the day, we tend to have a higher mortality rate being pregnant after having the baby and things like that. So that would make me want to really be at a doctor's face like, hey, am I right?
Is my baby okay?
I don't feel my pulse. I don't feel my pulse. You know what I mean? So but a lot of the times, that's not what happens in our communities. Yeah. We show up to the ER, baby coming out. That's the first time you done seen a doctor in how long? Yeah. You got all these different conditions. You got high blood pressure you ain't know about. You got diabetes you ain't know about. And that contributes to it too. So it's not just the doctor. It's us as patients too. We got to understand, look, I got to take care of my own health. Right. You know what I mean? Those 9 months, it's not just me anymore. It's me and my child. So whatever problem you have with doctors, at the end of the day, it's not about you no more. Right. Because that baby can die. You know what I mean? Yeah. Pregnancy is to have a healthy pregnancy and have a healthy baby. People don't know how blessed you are. That is not normal. It's a lot of unhealthy pregnancies here. It's a lot of unhealthy babies that's coming out. You know what I mean? Black women, we got the highest amount of premature babies. Like, it's a lot of stuff that goes into it. So people think pregnancy is, you got, I don't want to say that guy, you got, a few children. Ain't nothing wrong with that. And they were healthy pregnancies and healthy babies, but that's not, you are blessed for that. Right. A lot of people can't have that. Right. So, Go see a doctor, God. Hear out your doctors. Let them know if they not looking at you when they talking to you. If they like this. Last period. You having sex? STD? Like, you feel that. You feel the. You're supposed to have a connection with your doctor. That's supposed to be your girl. That's supposed to be your dude. Like, if you don't feel that, you're not gonna look at my vagina. I've been in a doctor's appointment where I literally said, I don't feel comfortable taking my pants off with you. Can you get somebody else?
Yeah, no, you got it.
And what they gonna do? Go get somebody else. So you can't be afraid to speak up. The white coat is just a coat. It's just a coat. They're people like me and you.
All right. That was a great conversation about that. But moving on to our last one that we're going to cover is birth control is bad for a woman's body. Do you agree or disagree? We had a couple people commenting on it. Pagan _ smiles _
Pagan on it.
Pagan! She had just followed us too. So that's good. She's been commenting on a lot of them. But she said, I feel like it can be. There are plenty of women who take birth control to regulate menstruation who aren't even sexually active, but I've also heard her stories about the implant in your arm, weight gain, loss, anxiety, depression, not being able to remove the implant, etc. I think as women, we just need to be more conscious of the chemicals we put into our body, and when we experience side effects, mood swings, irritability, etc., not to brush it off and to immediately speak with our doctors. So she's not saying she's like against birth control, but she's just saying everybody's different, and we had that same conversation, just saying it depends on the person's body. And then we had our own camera lady, Candy King, saying that she agrees it has negative effects. So what is your outtake? Do you think birth control is bad for a woman's body? Give us the truth.
Right?
I mean, it's like any type of medicine you take, it's going to have pros and cons to it. So what's the deal?
I am really passionate about this. I don't want it to come off the wrong way. Let me take a sip.
Okay, let's take the whole having sex part out of it. If you're just taking it for, let's say, you know how sometimes you put your kids on it when they're
there are so many different types of birth control. It's hormone-free birth control. It's estrogen, progesterone. It's so many different types. And if you go to a doctor and you start having negative effects and those horror stories actually happen, you can go to that doctor and get on a different method of birth control for your body. If you need it, like when I first started taking birth control, I needed it for my cramps. They were really, really bad. Some people use it to regulate their periods and stuff like that. I think why do you think people fight for it so much? It's a beautiful thing that came to us, that we're able to choose whether or not we want to be pregnant or not. Right? Because the fact of the matter is, pregnancy is about the scariest thing that ever happened to a woman. It is a risk factor for everything I have learned in 2 years of medicine. Everything. We learned about a disease, risk factor, pregnancy. I'm like, oh, we can't have nothing. But it's real though. So that's why I keep saying about pregnancy. People think you see your cousins, your moms, and everything like that getting pregnant all the time. You think it's nothing. It's actually really hard on a woman's body. That's why people fight so hard about, being able to have abortions, being able to do this, to have birth control, because it is hard on a woman's body. Now, you take that, you take the weight gain you might get in an implant and the weight gain you're going to get having a baby in 18 years of that, I think it kind of weighs like that. And I don't think really people think about it like that. Like, when you're fighting to have control of your own body and have control of your future, 5 pounds of weight gain is not that big of a deal to me. But that's me though, because I know what pregnancy looks like. I know the beginning, end, and the middle of it, and then the 18 years of it afterwards. You know what I mean? So not that I'm not gonna say pregnancy is a bad thing. You want to have a baby and things like that, that's fine. But if you don't, right. The implant, I love IUDs. I know they have a bad rep from maybe 20, 30 years ago when they first came out, but the things are off the chain. Almost everybody I know, almost every doctor I know has an IUD. So like IUDs are great. I haven't heard any problems with the implant actually. What else? If you can't take a vitamin every day, you can't take a pill every day. So you got to start thinking about like all these different methods. But do I think it's bad for your body? No, there's so many different ways you can do it. People just know about the shot. Mm-hmm. You know, a lot of people go to the shop when they start talking about birth control. Oh, I would gain 20 pounds. But were you eating pizza every day too?
Right.
You know what I mean? Like, was it the birth control? Or you ain't been to the gym in 2 years? Like, what really was it? And you are dealing with hormones. You are dealing with things like that. And a lot of people say you can't get pregnant after you get off of birth control. That ain't true.
Right.
You can get pregnant. Your body is so strong. People don't give your body enough credit. Your body is really, 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 really smart. Them hormones go away. Give yourself 5 months and have unprotected sex and see what happens. You know what I mean? Right. So now I'm not going to be like birth control is and all be all. Everything has its negatives. But you gotta weigh those pros and cons for yourself. Right. What do you want for yourself? Right. Can you deal with a little bit of weight? You know, I had no problem with my birth control.
Yeah, I didn't either.
You know, and if the weight was big, if it went in the right place, you know, ain't no issue, ain't no problem, no harm, no foul. But I never had issues with my birth control, and I know you know it helped me with my mood swings. I was tripping. PMS was crazy.
Yeah, I never had problems with my birth control either. But then I also know people that got really depressed when they were taking it. I've known a lot of people that have different problems with their birth control. But personally, me, no, I haven't.
And when they get depressed, if you have a doctor, if you have an OBGYN, you go to that doctor, and I'm not feeling right on this, can we do something else?
Right.
That's
yeah, but the crazy thing is a lot of people don't have doctors.
Yeah.
So because they don't have insurance.
That's the issue.
And people our age, what do they do about that? So they're just self-prescribing themselves and going to get the free medicine that they can get so they won't be pregnant, but then they're getting depressed and they're going through all of this. So what do you recommend that they do then if they can't afford a doctor?
If you can't afford a doctor, see if you qualify for Medicaid, number one. There's no, I see a lot of people ashamed of Medicaid. There is no harm, no foul in taking care of yourself, no matter how you get it. Government, you know, if I could qualify for food stamps, I'd be stamping on the food, period.
Money,
you know what I mean? But I know the stigma behind it and stuff. But Medicaid, you can still get good doctors that take care of you. You have somebody to go to. If you can't qualify for Medicaid, there are certain I have to look this up, but there are certain like programs you can get into where you can try to get cheaper birth control or possibly free birth control. Some programs do stuff like that. If you have a Planned Parenthood, we don't have one no more because we ain't gonna talk about that. But if you do have a Planned Parenthood in your neighborhood, go to Planned Parenthood. That's what it's for. People think it's for abortions. No, it's for women's health, like birth control. You got older, go to Planned Parenthood. If you don't have insurance, that's what that is for. That's why people fight for Planned Parenthood, because that's what they do.
Right.
They protect all of the women. You know what I mean? So, like, do that. What else? I think that's pretty much it.
All right. Well, it was nice having you, bestie. Okay, Bria Peacock. Thank you for coming and meeting us on the show. She came all the way from, Augusta to see us because that's where she's at. We are just going to go ahead and wrap it up. Our next episode, I think it's going to be about resolutions, New Year's resolutions. I think that's what we decided. I don't know. We'll keep y'all updated. I can't really think of anything right now. These mimosas are just really good. But thank you for listening. And I forgot in the beginning. This is DFY podcast. I'm sorry I didn't mention that in the beginning because we went straight into introducing our guest for the day. Well, she had great content. I wish we could speak a lot longer. We'll probably have her again isn't there like a women's health month or day or something like that, probably sometime next year if she can come. But thanks for listening and see y'all later.
Bye.
Bye.